everybody. Welcome to another episode of Rapping with the Rep. I'm State Representative Ken Gordon, coming to you from my home office here, and we're going to talk a little bit more about the current emergency situation caused by the COVID-19 virus. So far in Massachusetts, and today is the 5th of May, happy Cinco de Mayo, there have been 69,087 cases of the coronavirus, and unfortunately there are 4,090 who have perished as a result of this virus here in Massachusetts. It's a very, very serious situation that we face, and every one of those lives is important. If someone that you know has been affected, has passed away from this virus, my thoughts are with you. My sympathy is with you. I'm very, very sorry. And to the extent that you're currently suffering from the symptoms of the virus or are in self-quarantine as a result of contact of the virus, I hope you feel better. And again, our thoughts are with you as you fight through this disease. So far, there have been 324,260 people tested for the virus here in Massachusetts. Tests are becoming more readily available. We'll be testing more people. But you'll see that a very large percentage of the people who were tested so far still have been tested positive. Nationally, about 67,500 people in that ballpark have died from this virus, and about 1.1 million cases have been reported. This, again, is a situation that, for me, it's the situation of our lifetime that we're facing, because it's a long-term matter. This is an illness that currently people are suffering from. Nursing homes are overwhelmed by the infections that are happening there, and we're doing everything we can to face it, but it's unfortunately like waves in the beach. It's continuing to come, as opposed to some of the situations that we faced, which is an incident that happens and then we recover from it. The road to recovery begins quickly. Here, the road to recovery is a long process. So let's start with what we've been doing as a society, and I want to remind you that this is so important. First of all, one of the new instructions that is coming out from the governor's office, in fact, it's an order that's come from the governor's office, is to wear a mask when you're out in public. Now, the mask doesn't have to be anything fancy. It can be a shirt. It can be a scarf. It can be any number of things. And there are people in the area who have been making masks out of cloth, and that's fine. It should not be the N95 mask that's really should be reserved to healthcare workers and first responders who really need it. There doesn't have to be anything fancy for you to get something to make a mask. You don't have to sew to make a mask. There are plenty of videos online and places that you can go that will show you how to make a mask out of just a scarf or any piece of material and a couple of rubber bands. You can do that. I know that CVS is selling the masks, but you shouldn't have to necessarily buy one if you don't want. They're easy to obtain. Now, the masks are to be worn when you're out in public at a place where you expect to be with people. That means if you go to the supermarket or to the pharmacy, you'd expect to be with people, and you have to wear a mask in those situations. If you're going out for a walk when you don't expect to be with people, you don't have to wear a mask. What you do have to do is, if somebody comes upon you, just give them some space, stay 6 feet away. As the governor said, if I go out at 6 o'clock in the morning for a walk, I don't expect I'll see anyone. I don't wear a mask. But if it's 6 o'clock at night where a lot of other people are walking around, and if the streets are narrow, that's when you would bring a mask. There are some great paths in our area that you can go out and walk in a natural setting, and that's great. But if it's at the time of day where other people are out there walking, and you're walking in different directions where you may run into each other, at that point you can have a mask in your pocket and put it on when people are coming by. Now, this is no longer an advisory. This is an order of the governor, which means that local law enforcement can enforce it. Now, I expect that what's going to happen is they're just going to give warnings in the beginning, instructions to be wearing the mask when you're out. But it can carry with it a fine of up to $300. So please take it seriously. If you find someone else is not wearing a mask, it may be there's a reason for that. There may be a medical reason for that. But I don't advise you to get involved in any type of a conversation or altercation with other people. The Board of Health can handle that. And one other thing, I mean, we all have a First Amendment right to communicate however we want, but I'm seeing some things on social media intended to shame people. And remember that, these are our neighbors and our friends at the other ends of these communications. So just be kind. In fact, speaking of kindness, we've just begun the month of May. And in Massachusetts, thanks to a group of second graders at the time, I think they're probably sixth graders now here in Burlington, May is officially the month of kindness. And that's actually kind of important, especially this year, to remember that this month, May, we should be kind to each other. There's a group here in Burlington headed by Joyce DeLeonis called Help Us. It's a group that really is out there to help people. And boy, they're needed now to help us get through some very tough times. But they were behind, along with a group of children from Francis Wyman School, this effort to convince Massachusetts to set aside the month of May to remind each other to be kind. And every year in May, the governor issues a proclamation, and he either has already done it or he is about to this year, to tell people to just remember to be kind to each other. He was delighted to have signed that bill into law 4 years ago, and he's still happy to sign this proclamation as the law calls for him to do each year. It's really a year that we need to look out for each other. So if you've got an elderly neighbor, maybe give them a call. Don't necessarily go to their door and knock, but give them a call, or friends. Just check in. People like to hear from each other. It's a way of staying connected. If the internet is available to you and you're comfortable doing it, reach out to your friends and stay connected through video conferences of some sort and things like that. This is technology that hasn't been used much, but we can use it now. And once you're comfortable with it, it's a nice way to see each other and talk to each other, have lunch or dinner with someone else over the video, and it'll help get through this time. We've been using this term social distancing, but I think that's a bit of a misnomer. I'm not sure that's the right word. I'm really beginning to use the word physical distancing, because we physically need to put space between us and other people so that this virus doesn't have an opportunity to jump from one person to another, especially through the droplets that we unfortunately create when we speak. It's just what happens through human interaction. Again, that's why the masks are so important, because it's not necessarily, in fact, it's less to protect you from other people's droplets from the virus that can come to us through other people. It's really a way of protecting other people from us. And so we do it for each other, and we distance for each other. Again, this is all to prevent the spread of this virus. Recently, including here in Massachusetts and at the State House, there was a demonstration of people, hundreds of people who came without masks, standing close to each other, to protest for their freedom to be able to ignore the advisories and now orders that we stay distance from each other, that businesses close to protect each other, and that we wear these masks. These masks have now become a symbol for some people, a very, very small number of people, but for some people of freedom and independence. And, I just want to tell you, in my opinion, it's one thing to be free, and we are free. And we do have the right to do a lot of things for ourselves. But sometimes when the experts tell us it's time to do that, we have to do things to protect each other. And this is one of those times. Massachusetts has been very hard hit by this coronavirus. And one of the reasons why Massachusetts has been hit so hard is, remember that there was a conference in Boston organized by a company called Biogen. And there was someone who came to the conference. I think it was one person. It might have been two or three. But it was a very, very small number of people who went to that conference infected with the COVID-19 virus. They came from another country. And within a couple of weeks, the number of people that went to that conference who became infected with the Corona-19 virus was immense, absolutely immense. And those people all went home. Some of them were local and some of them had flown in from other places, but they all went home and they spread the virus with them. In Bedford, there was a person who became infected out of there. I know that directly, but I know that in many of our communities, we were affected by this one Biogen conference. Well, if that's the case, from Biogen, which had 300 people, then you can imagine what just happened in a gathering where I think I could see maybe 600, 700 people in a space as small as or smaller than that conference that went on at the Marriott. How many people were able to pass this virus to each other just because they want to assert their right to be free of government intrusion, right? And we should be free of government intrusion, but sometimes the government gets involved with our lives to do good. Sometimes it gets involved with our lives because the scientists are telling you them this is what happens. Biogen is an example of what happens and how people get sick. So that's all the way of saying, please have patience. You know the expression, it's always darkest before dawn. And I think this is the time. Dawn is upon us, which is to say Massachusetts seems to have gotten through the surge, through the worst time of this virus right now. Our instances of positive tests, has been lowered. So we seem to be on the down end of the surge. If we continue to do everything right, it will continue to go down and we can start to reopen our businesses. So the dawn is coming. The sun is coming. So just stay patient, please. We have constituents who contact us with questions, and I want to make sure I address some of those. But one is with respect to these masks. I think I really just answered that. You don't have to wear them when you're out in getting fresh air and you don't think you're going to come upon people. So that's first. Just stay 6 feet away from people, okay? And you're not locked down in your house. That's a word that's been used in emails to me and calls to me, ending the lockdown. Well, there's no lockdown. And the reason is if there was a lockdown, I wouldn't be telling you that you can and should go out for a walk on some of these nice days we've been having. You can and should go out for a car ride locally if you feel like you're getting cabin fever. Staying within a car that you're not going to spread a virus. If you need to go to the grocery store for your own protection, try to limit the number of times you do that. Do a large shop. Go to the pharmacy when you need. But you're free to do that. All of those things you can continue to do. Just remember to distance. There was maybe it was a meme that I saw somewhere, but it does make sense. It's like a book of matches. Just separate the matches and one won't light the other. And remember that. You can order takeout from local restaurants. And I think that's a good thing to do. There are people who believe that they're taking a risk by doing that. And look, everything is a risk these days, so I'm not saying there's no risk with anything. But when you're weighing the risks of things, remember that restaurants are inspected by the Board of Health. So those kitchens have to be clean and remain clean. So it's nice to remember our neighbors, our business neighbors, and the restaurants especially. You know, they've been there for us when our kids in schools have asked for fundraisers and things like that. They've been good neighbors, and now they're really struggling and have been struggling now for 6 weeks. So if if you come upon a time where you would have gone out to a restaurant and had dine-in service, you can still, in many of our restaurants, do takeout, and they'll replicate the meal for you. You can't have it there, but you'll give yourself a break. You won't have to cook that night. It'll be good for you, and it'll be good for the restaurant if you can afford to do that. Now, not everybody can afford to do that these days, and let's not forget that either. 1 of every 4 people has lost their job in the last 6 weeks, many times working for a company that they thought was particularly solvent and doing well, and then all of a sudden was closed down by the government in order to keep us healthy. And to you, first of all, thank you for the sacrifice that you're making, because it is a sacrifice that you're making for the common good. If you're having trouble with your unemployment insurance, if your application or getting benefits, please call my office. The number should be flashing from time to time at the bottom of the screen, but it's 617-722-2575. Please call us. We're there, we're working, and we've been helping many, many people get through the unemployment kind of maze that's out there. Now, the people who work for unemployment are doing the best that they can. And for the most part, it's been working. But there are glitches that have come up from time to time, and I think the biggest reason for the glitches is because a lot of the people working for unemployment either are newly hired. The governor is talking about how we went from 50 people in a room to 750 or more people that are now working remotely. And so you have new people working in a job during a crisis, and largely dealing with people who are frustrated at the other end, justifiably so. So have a little patience. Remember that they're trying to help, and we're there to help you. And so call us if you're frustrated. Please don't give up on your unemployment benefits. Please don't think that there's a reason or anything going on that that someone is out to try to avoid paying these benefits. We can help, so please reach out to us. We also have been working with local small businesses with respect to the PPP plans and some of these federal CARES Act plans. Now, that's not our real role as state representatives. We had a recent Rappin with the Rep show where Congressman Moulton came on, and we discussed the new programs, the new CARES Act programs as they were coming out. And I'm planning on having another show either with a congressman or someone from his staff so we can talk about the CARES 3 Act that just came out last week, which has a revised PPP, more money in it. That's payroll protection plan, a new one. And we'll have someone from the federal government on soon so we can continue to talk about this help for small business. Our small businesses are facing tough challenges, and they're going to get just as tough, sometimes even tougher. We're talking about now, we're at the point where there'll be a plan submitted by the 18th to reopen many businesses, but they won't be reopened all at once. And all businesses won't be reopened at the same time. So keep that in mind, okay? And that's tough because I hear things like restaurants will be obviously required to spread out the tables. And bar service will probably not be. I mean, I don't know this for a fact, but logic tells us that sitting at a bar is going to be a real challenge if it's allowed at all. So our friends in that business, again, are going to be looking at how am I going to pay my expenses when I have the potential to only serve half as many or a quarter as many people. So we need to address helping them as a government, whether it's the federal or state government, and we're working on that. So one business that some restrictions were loosened yesterday is the Florist Business. Mother's Day is coming up Sunday. Don't forget to call your moms. But florists can now open. There are restrictions to it, but they can open and they can sell flowers for pickup and delivery. So you can call the local florist and we have some great local florists in Bedford and Burlington. Think about your local businesses, please, and send some flowers out to your mom or the moms in your life. Also, car dealers are now, with restrictions, have been allowed to open to sell cars. Those restrictions include no test drives. You can imagine why that would be. And in-person sales, that conversation, that's the traditional way that cars have been sold, it will be replaced by virtual conversations and things like that, so we can do it. Now, I mentioned there's a task force that's been assembled. It's led by the Lieutenant Governor, Karen Polito, and they're taking suggestions on not only ways that we can open businesses beginning later this month, hopefully, if the healthcare experts tell us it's time, but also things like golf courses, perhaps some other sports opportunities where it's solo sport. And an important primary race is going to be the Senate race between Congressman Kennedy and Senator Markey. If things are the way they are right now, people are uncomfortable going to the polls. We did pass a law that allows the towns the flexibility of providing essentially excuse-free absentee ballot voting in the municipal election, which for Burlington is going to be early in June, and for Bedford has already occurred. But for Burlington, it was able to take advantage of not only moving the election off, but if you are more comfortable voting absentee, you can contact the clerk's office and you can get an absentee ballot. It's that type of a situation. People have been calling it mail-in voting, but I can tell you what it really would be is expanded absentee voting. And they want to make sure that we can do that people can choose to vote by mail or drop off a ballot at their convenience, so they can avoid the crowds on Election Day. The Secretary of State is working on just such a bill, and we can talk about it on Rapping with the Rep more when it comes out, but I expect it's going to allow our voters to do pretty much the same, which is have access to an absentee ballot. Okay. Other things have been discussed, both within the State House and outside the State House. So I don't know the details of what will end up coming out, but I think that will be the concept. We've been hard at work in our office, and even though the State House, the building is closed, that means that except for us representatives and senators, staff is basically encouraged to work from home, and our staff has been working from home, but we return our calls right away. As I said earlier, I think what's kept us the most busy these days is helping people with their unemployment claims, so please call us if you have that. But we're also trying to help our healthcare providers and institutions get the equipment that they need to treat people during this virus. That's been really a challenge, and we've been involved with those efforts. They also have been challenged to get staffing because, unfortunately, our healthcare workers are treating people who have the coronavirus, and so they're vulnerable for getting it themselves, and many have, and then they have to take time to quarantine, and during that time, during quarantine, it creates a staffing situation for the provider. You can see how that circle would be created. So we've been trying, working with our colleagues from the state and in the private industry to help with staffing conditions. Now, in addition to that, the people who are out on quarantine, now they're missing work themselves. They're not unemployed. They should be able to have their job back, but they've got to be paid too. They have a family too, and in their situation, they willingly put themselves in a situation where they're confronting people who could pass along the virus. I filed a bill yesterday that will make sure that if any essential worker, anybody who's out there at work, working for a business that's been open because it's an essential business, and is interacting with the public or with other workers, if that person contracts the COVID virus or is required to self-quarantine because of contact with the virus, that they are entitled to a workers' comp claim. And that means that they'll get paid through the comp system as if they broke a leg in the course of their job. So this would be no different than any other workplace injury. But this wouldn't require the employer to have to pay them directly during that time. And that's important because the employer now has to go out and replace them. If it's a healthcare facility especially, we want our patients to be able to receive the care that they're entitled to. And we don't want to overburden, say, a nursing home struggling to stay at full staffing at this time by requiring them to pay it. But this would allow for the comp system to pay it. It would also guarantee what we call job protection, which is it would guarantee that that worker could come back to work. So I'll keep you folks updated as to the progress of that bill. I also am a member of the municipalities committee, and in that way we're trying to help towns and cities get through this current situation and be able to fund their needs. Town meetings in Bedford, Burlington, and Wilmington can't go forward in the way they traditionally do because we can't have gatherings of the size that occur when we have town meeting. So what are we going to do? The town has to still pay its bills, and the town really has to address its needs. So we previously filed a bill that allowed the town to postpone, well, that worked for the short term. And now we're looking at the best ideas to allow some towns that have elected town meeting, like Burlington, to perhaps conduct a meeting virtually because there's a limited number of people who can vote, and the town moderators can reach out to those people and make sure they can connect virtually, make sure they have a device and the software that it goes to. But a town like Bedford and Wilmington that has open town meeting, well, there any resident has the right to come and vote. And so that's a little different because there are not just a finite number of people, or that number of people is in the tens of thousands, that we'd have to make sure had the ability to attend in a virtual way. So we're looking at those challenges as to how to conduct maybe break up town meeting piece by piece, break up by warrant article, piece by piece, by topic, and be able to move forward in that way. And so we'll see what we can do to best help towns to conduct their business that way. We also have to pass a state budget. Usually the House of Representatives passes its budget in the month of April, so we would have finished our job by now, and in the month of May it would be turned to the Senate, and the Senate would be preparing to work on its version of the budget, and then we would work out by June any differences to be sent to the governor, who still has an opportunity to veto portions of that bill. So that this could be worked out, hopefully, if it's on time by the end of June. Now, our budgets often are not done on time, and we pass a measure to fund the government for 1 month, essentially, while it's being worked out. That's not unusual because it's important to get things right. It's important to hear all sides of the issue. But now our problem is we can't even meet in a healthy way in person to debate the budget and pass all of the amendments that we need. Once the House comes out with its idea, once leadership comes out with its idea, then it's up to the members to provide their input through what we call amendments to that budget. Well, it's very difficult to do that now, but this week, and in fact that was also done just yesterday, we were finally able to pass a method in which we'll be able to conduct formal voting sessions remotely, so that people can watch the session streaming on the internet on the website of the legislature, and then have a relay, a person that we can call in who will be on the floor. So if we want to speak on an item, on a bill, or on an amendment, We can be connected to a speaker. It'll be played through the system, and anyone can hear us speaking. And once it comes time to voting, we can call in our vote. So that will allow us all to be able to participate, but we can do it remotely. The other thing that we're doing in my office, and I think my colleagues are also doing the same, but what we're doing is we're conducting virtual office hours every Thursday at 11 o'clock. We're doing it through a Zoom conference. And just to keep security on it, we're inviting anyone interested in coming and attending this conference to just give us a call or send us an email. My email is probably on the screen now, but it's easy. It's kenneth.gordon. My name is spelled Gordon at mahouse, that stands for Massachusetts House.gov. As I said, our phone number is 617-722-2575. So just contact us. Tell us you want to join, and we'll send you the information that you need to get onto the Zoom conference. You can do it on your computer, and we can see you, or you can do it on your phone, or you can, if you have an iPhone or an Android, we can see that way. If you want us to, you can mute your camera too. But you can also, through any phone, just call in, and the audio will be connected. We talk for about an hour. If there's something in particular that affects you, we can make an arrangement for a more private conference, or we can just talk about the issues of the day and the concerns that you have. You can also call. I just gave you the phone number. You can always call us. You can always email us with any direct concerns. And again, you have that information. It's important through this time that you realize and you remember that if you're feeling particularly stressed, anything that's affecting your mental health. I mean, this is a very common symptom of the feelings that we're going through, the frustrations that we're going through right now. So please reach out to your primary care physician and tell them that you're just, you may have issues that you'd like to talk to somebody about. And usually these health networks will set up a telemedicine appointment, which is a conference over the phone or over the computer, and they're all covered. And that's very important that you get the help that you need. Along with the mental health help that you need, it's important that you reach out for the physical health help that you need. Because of the work that's been done with the physical distancing and all of the other things that we've been working hard to do, and all the work that's been done by the state government to increase the capacity for our healthcare providers to provide beds in hospitals and arrangements like that, we have capacity to care for people who are sick with things that are unrelated to the virus. And you may have read that the governor is legitimately concerned that suddenly our hospitals are not seeing people that have things like concerns dealing with their heart or lungs or other things. And we know that doesn't change. People are still facing healthcare situations. But what has changed is people are not as willing to go to the hospital when something's wrong, or as willing to go to the doctor when something's wrong. It's still safe to do that. Our doctors are making arrangements to make sure that they keep people apart. And we need to stay healthy, and we can stay healthy. We live in a state that's among the best in the country and in the world for healthcare. And those great healthcare centers are still there to keep us safe, to keep us well. So please keep in mind that if you need them, still reach out to them. Folks, this has been a series of cable shows that I've done. It's a little different than the way I started this, for sure. But I want to keep us informed and connected, to know that we're alone, but we're together in this. And together we're going to get through this. We'll get through in a way that's different than it ever was before, that's for sure. But we will get through it, and we'll look back on it, and we'll remember that we stayed strong here in Massachusetts. And despite frustrations, despite a lack of what we wished we had right now, that patience and perseverance will pay off. So From me, from my family to you, we wish you good health and stay well through this situation. I'll be back again soon. This is State Representative Ken Gordon, and this has been Rapping with the Rep.